Krisztal. Thank you so much for joining me here live in Dallas, Texas on the Valder BB Show. How are you today?
I'm wonderful. Thank you so much for having me.
Thank you. I want my audience to know that Andrea Krisztal, she's the VP of UnitedHealthCare Individual and Family Plans. Well, Andrea, okay, it's enrollment time. Let's talk about maybe your individual and family plans. Who qualifies for these plans?
Great question. We get that a lot. Individual and family plans are really designed for just that, individuals and families that may not have coverage currently. So this could be somebody who's retired a little bit early before that magic 65-year-old birthday that they'll receive Medicare, and they're looking for something for that gap in coverage between the time they leave the workforce and start their Medicare. It could be someone who's self-employed. Maybe they own a salon or a restaurant and a small business, and they're not able to offer health insurance for themselves and their employees and their families. It could also be a student that's no longer under mom and dad's coverage, or maybe they're in an area that they need a different kind of coverage. But really, all individuals are between the ages of 18 and 64, or they have families that might be a little bit younger than that, and they need access to quality, affordable health care.
Today, we usually put out a text or an email letting them know who the guests are going to be today. You got really good response. What we found out, though, a lot of people, this is in our audience, because we have an audience of 1.7 million people born between 1946 and 1964. Anyway, they said that they had great plans, and they found out that they just have original Medicare. How can you help those groups?
Yeah, so those individuals are actually going to talk to our partner teams, and I'd be happy to put them in contact with our Medicare and retirement teams. They're absolutely amazing. They've been in this business for a very, very long time as well. And they can help those individuals that have original Medicare to find out what the most appropriate plan is for their individual needs.
You know, one of the things, though, is affordability. Are there any resources to help make healthcare coverage more affordable?
Absolutely. That's something that's at the top of all of our minds. And individual and family plans are part of the Affordable Care Act. And affordability is right there in the title. We want to make sure that no one ever has to make the choice between groceries and prescription medication or going to the doctor. That's just not a choice we want to see anyone have, and it's not going to lead to quality health outcomes. One thing that's actually not always known in this space is that over half of the UnitedHealthCare members on an IFP plan actually pay $0 a month for their coverage. Their coverage is covered in full. 90% of our members have some sort of subsidy, whether that's an advanced premium tax credit, or they're actually getting part of their coverage paid for month in and month out. So there's a number of different programs that are available to help people make sure that these plans are affordable for them, and that's baked right into the programs.
One of the questions, we'll take this one from Instagram. The poster is saying they have Medicare and Medicaid. Do you have a plan for them?
Absolutely. And that would actually be that same Medicare and retirement team, as well as our community and state team at UnitedHealthCare. Two amazing teams that focus on the Medicare population, the Medicaid population, and where those two pieces merge. And they'd be happy to take care of those members as well.
Okay. We're going to get more information. As you can see, a lot of people have questions about this health coverage.
Absolutely. And now's the time to ask those questions. We're right in the middle of open enrollment. So for individual and family plans, it starts November 1st in most markets and is going to run through December 15th. And then again for January 15th for February 1st start dates. Now's the time to look. The best place to start is at uhc.com/exchange for individual and family plans. You'll also have drop-down menus there for the Medicare population, the Medicaid population, and the dually eligible population for those members that are looking for that specifically.
Andrea, with a degree in healthcare policy and public health, what do you see on the horizon for us as consumers of healthcare?
Wonderful question. I can't really speculate, obviously, on what's going to happen in the future, but I can tell you that at UnitedHealthCare, we're very dedicated to the needs of our members moving forward. regardless of what that looks like in every single consumer segment. So whether that's our individual and family plans, our Medicare population, or our Medicaid population, we want to make sure that we continue to serve the needs of those members for the long haul and give them healthy outcomes.
Okay, well, with people in places like you at UnitedHealthCare, I think we're going to be in good hands. I want to thank you for stopping by the Valder Beebe Show and talking to my audience. This is the right audience.
Thank you so much, Valder. I appreciate you having me today.
You are welcome. Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.